When I started studying geographic information science up at Lehman College in the Bronx back in the early 2000s, I just wanted to make maps, to be honest with you. And I was more interested in standard environmental science, ecology, biology, even type work. And I was making maps of different health outcomes, heart disease, respiratory disease, as well as some maps of race and ethnicity and income and things like that, and poverty status. And I kind of messed up making the maps, and I couldn't remember which legend went with which map. And then I realized it didn't really matter. Their spatial distribution of all the maps were really, really similar. In other words, where there was high rates of poverty, there was also high rates of disease and also high rates of like non-Hispanic Black populations, for instance. And it was such a stark realization for me that I was like, I have to study this. I have to do work on inequitable distribution of all the bad stuff that we have in New York City. And that's why I got interested in public health.
That was today's guest, Dr. Andrew Maroko. Hello and welcome everybody to Making Public Health Personal. This podcast is brought to you by the CUNY Graduate School of Public Health and Health Policy in New York City. I'm your host, Laura Meoli-Ferrigon from the Office of Online Learning here at CUNY SPH. Each episode of Making Public Health Personal focuses on an aspect of health and social justice that affects our daily lives. We'll learn from expert faculty, researchers, alumni, and students on how public health policy, advocacy, and practices can benefit our ever-evolving community and our world. You don't have to work in healthcare or have a PhD to understand these topics. We're going to break them down for you and give you practical tips to make a difference. Today's episode is about a hot topic you may have been hearing about lately, period poverty, otherwise known as menstrual product insecurity. Specifically, we'll find out who is most affected by the inability to afford menstrual products, how this issue, like many other issues, was exacerbated due to the COVID-19 pandemic, how the policies we have in place in the United States surprisingly do very little to combat this problem, and what you can do to make a difference. Today's guest is Dr. Andrew Maroko. He is an associate professor in the Environmental, Occupational, and Geospatial Health Sciences Department here at CUNY SPH. Dr. Maroko's research examines health disparities, inequities, exposures, accessibility, and environmental justice. He recently collaborated with faculty at Columbia University and here at CUNY SPH on a US-based study called Menstrual Product Insecurity Resulting from COVID-19 Related Income Loss, which happens to be the topic of today's episode. Thanks for joining me today, Andrew.
Thanks so much for having me, Laura.
So before we get into today's topic, I really want to clarify this idea of environmental, occupational, and geospatial health sciences for our listeners. Environmental and occupational is kind of self-explanatory, I think, being someone's location and their job. But specifically, can you explain this core part of your research, which is the exploration of spatial variation and geographic associations among the environment and health outcomes? I think people might need some clarification on what that is.
Yeah, absolutely. So you kind of said it, right there where you were talking about how environmental is where you live, you're going to have certain exposures. So that's spatial, really. Where you live is a geographic variable. So you've maybe often heard that, a zip code determines your health. Although in geospatial sciences, we don't like using zip codes because they're designed to deliver mail rather than measure health. But where you are is going to define to a large degree what you're exposed to and what your lived everyday experience is. So geospatial health or geospatial analysis in general looks at the relationship between things in space. So for instance, where you live and where maybe a polluting facility might be located.
Okay, so like if you live by a power plant or something, how likely are you to have some negative health effects from that?
Yeah, absolutely. And so that's kind of like the baseline of what we do. And it captures a lot of it. So it's exposures, like you just described. It could be access. So like how close are you to healthy foods or to a park? Or it could be a little bit more complex when you're talking about spatial statistics and things like that. But it's based on location.
Great. And with this explanation of your work in mind, could you tell me a bit more about your research on menstrual product insecurity resulting from COVID-19 related income loss?
Yeah, absolutely. So this was a really fun study for me to do, to be honest with you, because I got to work with a lot of people from different disciplines, which to me is an exciting thing to have this inter or cross-disciplinary kind of exploration. To be honest, the spatial part of it was relatively limited. We did look at contextual variables to see if they impacted people's, I'll use the term period poverty here, to see if that impacted it. And it for the most part, in our study, it didn't seem to have a huge impact. It was more these other economic type variables that seemed to have a bigger impact.
So, who was involved with the research and when was the data collected?
One of the most fun parts of this, like I said, was that we had a lot of different people. So aside from me, from the School of Public Health, we had Dennis Nash and his team from the Institute for Implementation Science, which included Amanda Berry, Shivani Kochnar, Sarah Kulkarni. Then we had Marnie Summer and her team from Columbia. And so Dennis and his team are experts with implementation science, and they're the ones who launched this broader COVID study, which is a US-based study with a very diverse population. And they collected, I think, somewhere around 7,000 data points from individuals longitudinally. So like throughout time since early in the pandemic. Marnie and her team, Marnie Summer from Columbia, they are experts in menstrual product insecurity and menstrual hygiene management in general. And they include, so besides Marnie, Caitlin Brewer and Maggie Schmidt. And then we had people outside of that again, Angela Gwynn from University of California at Berkeley, and Penelope Phillips Howard from the Liverpool School of Tropical Medicine. So we had all these different people with different disciplines and different foci getting together to try and come up with an answer to this question. Does COVID-19 or did COVID-19 impact people's access and affordability of menstrual products?
So it sounds like a lot of really smart people who were involved in the research part of it, but who participated in the study?
So Dennis's team, which I'm very proud to be a part of, collected data of around 7,000 people across the US. They have to be over 18, so they have to be adults in the US and have valid email addresses, all that. For our study here, we had to limit it to people who had menstruated during the period of the data collection. So that resulted in around 1,500, mostly women, some people who identified otherwise. But for the sake of this, we can describe them as women. So I think 98 to 99% identified as women. Yeah, so about 1,500 people who had menstruated at some point since March in 2020.
And let's define what we're talking about here when you say menstrual products. There is a shortage right now going on and even some price gouging going for some things like tampons. But what are you referring to specifically in the study?
For the most part, we're talking about pads and tampons and common products like that. But we're also talking about menstrual hygiene management in general, which can include makeshift products like using an old t-shirt or old rags or other ways to cope with a lack of kind of store-bought menstrual products. So in this case, we have a very broad definition, but for the most part, it's kind of pad and tampon related.
Okay. Does it include pain relief products like Midol, Pamprin?
Right. So that's a fabulous question. And I think if we were to do it again, we would include that in terms of people's accessibility to it. But in this study, we did not specifically look at other products designed or that can be used around menstrual hygiene management, like pain relief products. But that's an excellent question. And in some of the qualitative interviews we did around this, which is not part of this paper, they did try and explore some of that.
So we've identified who was involved and what is involved, but how did menstrual hygiene insecurity correlate with the pandemic?
So that's an interesting question and not quite as simple as you might imagine. It didn't seem, at least in our study, to be directly related to the COVID-19 positivity rate, so the per capita number of people that were testing positive, or the mortality rate, but it did seem very significantly affected by income loss as a function of the pandemic. So those who lost, some of their normal income compared to baseline during the pandemic, possibly as a function of policies, places closing, inability to work for other reasons, had a much higher likelihood of having period poverty than those who didn't have income loss. So again, it looks more like a societal and policy related issue rather than an actual disease related issue for the most part.
Okay. And who was most affected by this issue?
Our sample size obviously were people who menstruate, so mostly women. So women, number one. Number two, it seemed that people who had lower incomes at baseline, so when the study began, those that had lower incomes at that point and those who had lower educational attainment, so less degrees, tended to suffer much more than those who were higher income or higher educated, which are correlated with one another too.
And what other issues were indicators or predictors of this problem?
I mean, what we looked at mainly here, our main, what they call exposure of interest, was income loss. So, women who lost their income had a much bigger problem than those who didn't. And again, like I said, lower income women be much more impacted than higher income women. But the impact wasn't just affordability of products, although that was the most significant that we found, or, that was the biggest magnitude of effect that we found. The other things that we looked at and we noted, meaningful results around were women experiencing increased stress when trying to find or get the products, using makeshift materials. So that's like a coping mechanism, changing their products less often, also a coping mechanism. Not being able to afford, like I said, was the biggest impact. And what we didn't see across the board was an availability issue. So earlier you had mentioned that there might not enough products and maybe people hoarding when there was a shortage, especially earlier in the pandemic. We didn't find that across the board, at least not related to income loss, but we did note that there seems to be less product availability in more rural areas versus more urban areas. But that wasn't one of the main findings because it wasn't a very strong association.
That was one of the really interesting parts of your research, was when it explained how menstrual product insecurity had an effect on people's not only physical health, but their mental health. I thought that was really surprising.
Yeah, and this is something for people who study this issue, like Dr. Sommer, that they've studied for a very long time in terms of how managing one's menstruation may impact your mental health, your level of stress, anxiety. So what we probably all know at this point is that the pandemic has increased a lot of mental health issues for a lot of the population for a lot of reasons. And that could be anxiety and depression and things related to that. When you add menstrual product insecurity to that, it increases it even further. So it's a cumulative kind of effect of these stressors. And they could be low-level stressors. They could be very high-level. Because something that we did find also was a meaningful relationship between period poverty and housing insecurity and food insecurity. So that kind of multiplicity of stressors can really have an impact on one's mental health, which in turn can have an impact on one's physical health, because everything is kind of related in this holistic system.
Absolutely. And those are essential items that are needed.
Yeah. And I think what you just said is actually the crux of the biscuit. They are essential items, but oftentimes, at least in the United States and in much of the world, they are not considered essential items by policymakers or by government in general. And that's a problem. And that's a gendered problem, because that's a problem that impacts women much more so than men. And, there's people trying to address this, but there's not enough people either in academia, and we need more people, advocating and fighting for this so that there is equity for menstrual products and menstrual product security.
Absolutely. And there definitely is a stigma or sense of embarrassment around having a period, which your paper touches on. It says menstruation continues to be perceived as something to be kept hidden and a matter of personal, not societal responsibility. People may thus feel embarrassed or ashamed seeking products from free sources like food banks. Would you be able to elaborate on that a bit more?
Yeah, sure. I think there's a lot of reasons for this, and there's a lot of different angles that you can take to look at this. In our paper, we didn't get that deeply into any qualitative assessments, but one of the issues from a different paper that I did, again, with Dr. Sommer over at Columbia, as well as Kim Hopper, who's at Columbia, he's an expert on homelessness and an advocate. We looked at menstrual product insecurity and kind of just menstrual management for the population that's experiencing homelessness. And one of the big issues that they identified, which is not so dissimilar from anybody else, is the problem of gatekeepers. So having to go through something in order to get that which you need. Mm-hmm. So in this case, let's say it's tampons. So if you need tampons and you're at, let's say, a food bank, which aren't required to have tampons, but maybe they do, somebody donated them, you still have to ask for them. You still have to get them somehow. So if you imagine you're a young woman that hasn't had to do this before, particularly if you lost income and now you can't afford to buy these products, you go to a food bank, which might be a strange experience for you to begin with. And then you have to ask, let's say, a middle-aged man for pads or tampons. Like that kind of societally induced anxiety and shame is something that, has to be dealt with and has to be considered when we're trying to increase access.
If you dream of making a difference in the world, a public health degree or certificate can give you the tools to do just that. The City University of New York's Graduate School of Public Health and Health Policy equips public health professionals to advance not only a healthier New York City, but a healthier world for us all. We want you to join us in our mission. Visit sph.cuny.edu to learn more about our programs. No matter where you are in your career, CUNY SPH offers a broad range of degree and certificate programs to not only help you advance in your career, but to have a real impact on the world. Public health professionals are needed now more than ever. Join us. Visit sph.cuny.edu to learn more.
And COVID-19 is definitely not the last public health crisis we're going to have. We already have monkeypox kind of right on its tail, unfortunately. It's surprising to me how public health issues can become sort of a domino effect. What should our government officials keep in mind when creating policies?
That's a good question. In terms of public health in general, the first thing I think the government should think about is equity. And in terms of period poverty specifically, we have to think about equity and access. So, and that access can be monetary access or physical access. People should have the ability to get that which they need to manage their menstruation without shame and without any sort of embarrassment and without any sort of problems, independent of what's happening around them.
Yeah, and it was surprising for me to read in your study that menstrual products are not included in most U.S. public assistance programs, meaning that they can't be purchased under SNAP, WIC, or other public assistance programs. Menstrual products are also taxed. Kind of doesn't seem fair. What can we do as citizens to make a difference for people suffering with menstrual product insecurity?
Yeah, I absolutely agree. It absolutely does not seem fair. A lot of states have removed the taxes around menstrual products, which is great, but we still have a bunch of states where they are taxed. So yeah, the first step would be removing the taxes. That's kind of a no-brainer and should have happened many, many years ago. But I think we can do a lot more than just that. And we don't need a pandemic to push us to do that. But if that helps us realize that it's an issue, then, whatever it takes, I guess. But like Scotland, for instance, anyone who needs a period product can get it for free.
That's great.
And we could certainly do that. And if you think about public restrooms, there's toilet paper in most public restrooms.
Yeah.
They don't charge you per piece of toilet paper.
True.
We need it. So why not just have bowls of tampons and pads in public restrooms?
Yeah.
So, but what can we do in our current America? Well, there's some like grassroots organizations that are advocates that people can go to their websites, like allianceforperiodsupplies.org, all one word. Period.org is another one, and periodlaw.org. So these three websites are all the organizations that have these websites are all quite good and do a lot of amazing work. I will add also that there's some public officials that are really doing a great job with this. And the person kind of leading the charge, and has been for a while now, is Representative Grace Meng from Queens. And actually, quite recently, she wrote a letter to Congress, or specifically to the Government Accountability Office, asking them to review the accessibility and availability of menstrual products to inform legislative efforts to advance health and economic equity for people with menstrual cycles in the United States. So Grace Meng, along with some of her colleagues, including Carolyn Maloney, who's the chairperson for the Oversight and Reform Committee, wrote this letter trying to get equity in these products. And they actually cited our study in it, which to me, like if there's any researchers listening that sometimes feel ineffective in their research, they'll do things and then it just sits there. Mm-hmm. You could argue that if you lose money because of COVID, you're going to have more trouble getting period products is kind of obvious. And one might say, well, yeah, of course, you have less money, so it's going to be harder to buy these products. Mm-hmm. But it's still important to show that in a organized and a rigorous study, which we did, because then policymakers can use that solid scientific information to then push policy towards a more equitable solution. And Representative Meng has been doing that.
Exactly. And I think it takes a crisis like COVID-19 or pandemic to bring something like period poverty to light, because it's not always at the top of everyone's minds.
Absolutely. And I think because of the pandemic and because of people's economic loss related to this pandemic, particularly women, because if you look at a lot of the data, women tended to suffer more economically due to the pandemic than men, often because they have increased caretaking roles. If the kids, for instance, are staying home from school because it's now remote learning, if they're little kids, especially, somebody has to still be there to watch them. And oftentimes that'll fall on women, or that'll fall on women more often than men. Literature suggests that. And so there's a bigger economic impact. So yeah, it comes into clarity when there's crisis situations. And this is an issue that's always been around, but it's more visible to more people now, including people that maybe previously it wasn't an issue for them. And so they didn't really think about it.
How did you get involved with this type of research?
So when Marnie over at Columbia, she invited me to work on this homelessness and menstruation work. I'd never worked on menstrual related issues before. I never really thought about it, to be honest with you. I never thought about it as an equity issue or as a problem. And the homelessness expert, Kim Hopper, was on it, who's a man, also had never thought about it. And he's worked with homeless populations or populations experiencing homelessness for decades. And both of us were really embarrassed for it just not occurring to us that this is something that's fundamentally important that we didn't even consider. So I got involved with it out of pure interest, but also out of, men have to research this. I mean, everybody has to research this, but the more aware we are of it, the more it's likely to change when you get 100% of the population thinking about it rather than 50%. And as someone with a daughter, it became, important to me to do it. And I get some great insights from her too. So it's nice.
Thanks again, Andrew, for being a guest and for sharing these great resources. To get involved with this important topic, you can go to period.org, allianceforperiodsupplies.org, and periodlaw.org. I'll be sure to share all those links in the episode description so you can make a difference. Thanks for listening to Making Public Health Personal, presented by the CUNY Graduate School of Public Health and Health Policy in New York City. You can now share, like, and subscribe to our show on Spotify, Apple Podcasts, Google Podcasts, and on our YouTube channel. To find out more about CUNY SPH, you can visit sph.cuny.edu or connect with us on social media. We're on LinkedIn, Twitter, Facebook, and YouTube. Just search CUNY SPH. This is your host, Laura Meoli-Ferrigon, signing off. And while public health has a global impact, that doesn't mean we can't make it personal.